Okay, Senator Crapo, you're recognized.
Thank you very much, Mr. Chairman. This is my amendment number D1 as modified. We sent around the modification about an hour ago. And the amendment, this is a continuation of the discussion in a general sense of the same issue that Senator Hatch has raised, only trying to address the issue from a little different perspective. Senator Hatch raised the perspective of people who would lose their benefits. This amendment would amend the proposed Medicare Advantage cuts in Title III of the Chairman's mark to prohibit the implementation of the changes to the Medicare Advantage program in any bidding area where the proposed changes would result in decreased choice and competition for the seniors in the Medicare program. In other words, the cuts that we see proposed here, I'm convinced, and I think many are convinced, will result in providers leaving the marketplace. And this amendment simply says that if providers do leave the marketplace, leaving our seniors with less competition and less choice of options, then we should not implement these proposals. During the question and answer walkthrough period that we had, Director Elmendorf, I think, clearly gave the answer to the issue that we've been batting back and forth here yesterday and this morning. He made it very clear that the proposed changes to Medicare Advantage in the mark are going to reduce the benefits provided to those who have Medicare Advantage plans by a little bit less than half of what they are today. Now, it may be true that some will get an increase and some will get a decrease, but the net result is that the benefits to be available under Medicare Advantage will be reduced by about half. That's what the CBO analysis has provided. I know that in the debate already this morning, Senator Conrad has indicated that Medicare Advantage is very expensive and that, in his words, we have a false sense that we can keep on paying for Medicare Advantage, that it's unaffordable, and that at some point we have to look people in the eye and tell them the truth about it. The truth about it is that this mark does seek to take $113 billion, I think it is now, out of the Medicare Advantage program, and that is going to result in less benefit to the citizens who now have enrollment in the Medicare Advantage program. In my home state of Idaho, there are 60,000 Medicare Advantage beneficiaries, 27% of the Medicare beneficiaries in my state. And that's just a couple percentage points, I think, higher than the national average. Since the creation of the Medicare Advantage program in 2003, the overall enrollment in private plans has been steadily increasing, and beneficiaries across the country now have more private plans to choose from than they did 10 years ago. And this increased competition is healthy. As I indicated in my discussion yesterday, about 80 to 90% of the people on Medicare Advantage are very happy with and satisfied with the coverage that they are getting, which is in stark contrast to the attitude that many others who are not on Medicare Advantage have with relationship to the coverage that they are receiving. According to CRS, as of January 2009, all Medicare beneficiaries had access to an MA plan along with traditional Medicare plans. My point is that Medicare Advantage is working. It is moving much more rapidly into the marketplace because of its acceptance among those who are our seniors who are able to make these choices. As a matter of fact, this choice is particularly crucial in rural areas. In rural areas between 2003 and 2007, more than 600,000 beneficiaries in rural areas joined the Medicare Advantage program, which is a 426% increase. Again, the point being that the reason the people are moving to this program is because, particularly in rural areas, they have very little access and little choice, and these plans are providing them with a better set of benefits than they would otherwise have. My amendment simply seeks to preserve that choice for America's seniors. It simply says that if the changes we are proposing in this bill today actually result in fewer providers, in less choice, and less competition in Medicare Advantage, then we should not implement them. We have not yet tested or seen how the proposals that are in the mark today will work, and there is a very big question as to what kind of an impact they will ultimately have. Mr. Chairman, a lot of attack has been made on Medicare Advantage, and certainly we need to address the overall excess costs in Medicare. Republicans have proposed many alternatives and continue to propose alternatives to deal with both the unfunded mandate in Medicare, the crisis that we expect to face in Medicaid as well in terms of funding, and in terms of overall reform of our health care system. And for anyone to say that there is not a very, very strong engagement in terms of the ideas about how we should reform our health care system is to simply misstate the truth. The bottom line here is we know that you can't take $113 billion out of a program after CBO has indicated that that change will result in approximately a little less than 50% reduction in the benefits available and not see a dramatic change in the availability of benefits to those who currently have these plans. If ever the issue of whether a person who likes their health care coverage today gets to keep that health care coverage was on point, this is it. For those Americans who are on Medicare Advantage today, they will not be able to have access to that coverage, to that health care option in the future under this plan, and I simply propose that we provide that if the competitive arena changes, if the number of providers decrease and we have decreased choice and competition for seniors in the Medicare system, that we should not implement the provisions of this plan.
Is there further debate?
Would the senator yield for a question?
Senator
Yes.
Stabenow was just recognized.
Thank you, Mr. Chairman. We've had a lot of discussion in the last couple of days on Medicare Advantage. I mean, the reality is, in broad terms, Medicare Advantage was an effort to allow for-profit insurance companies to be able to come in, begin to privatize Medicare. The argument was it would bring costs down. It didn't. It brought costs up. And now I find it interesting that there's an objection to have competitive bidding, which, in the broader sense, we always argue that competitive bidding will actually bring costs down. We were told Medicare Advantage would provide lower costs to be able to strengthen the integrity of Medicare. Instead, the majority of seniors, 80% of which aren't on Medicare Advantage, go see their doctor just on traditional Medicare, are paying more. We were told yesterday, I believe it was $90 a year, more, in order to be able to subsidize the private for-profit insurance industry to be able to participate with our seniors through Medicare Advantage. I believe that we have been working towards a very important way to resolve this for seniors who are currently on Medicare Advantage, to be able to allow them to keep what they have. But going forward, our responsibility, it seems to me, is to all the seniors under Medicare, all 40 million that are in Medicare, those in Medicare who now pay more than they otherwise would if we didn't have a program that subsidized for-profit insurance companies. One way to address that, to begin to move this in a direction to protect Medicare for seniors and to be able to offer the other great things in this bill on prevention, quality initiatives, be able to do the other things, to be able to make medicine more available, affordable, closing the donut hole, is to have competitive bidding. And so from my perspective, even though we certainly have substantial amount of Medicare Advantage in Michigan, and I want to make sure those who have it can keep it. But going forward, I think it's very hard to argue that something that was supposed to lower costs by bringing in more competition with the private sector has raised costs, but now we're against competitive bidding to be able to rein in the costs and to be able to protect all seniors. And I, Mr. Chairman, I would oppose the amendment.
Mr. Chairman, could I respond?
Yes, Senator Crapo.
Yeah, I want to make it very clear. I'm not against competitive bidding. I like competition. In fact, what my amendment says is that I like the fact that we should have more competitors, and that my amendment simply says that if the language in the bill or the concept paper does not result, or if the proposal results in fewer competitors, in other words, if we have a less competitive environment, then we should not implement it. That's all it says.
That's what I was saying. Yeah.
Would the senator yield?
Exactly.
Yes.
It doesn't make
I would suggest that you're supporting the wrong amendment, that what you ought to consider is not taking the inefficiencies out of Medicare Advantage by competitive bidding, which will take the inefficiencies out. I mean, it gets a cushy 14% more than Medicare fee-for-service. What you're trying to do is to protect the existing seniors on Medicare Advantage, and you'll have an opportunity to do that as I bring forth an amendment that will basically grandfather out most of the seniors on Medicare Advantage. Senator Hatch keeps referring to the Nelson Amendment. That's what you're referring to, Senator, is what's already in the mark. This senator has another one that's coming that's going to grandfather in most of the seniors on Medicare Advantage.
Well, to respond, first of all, I will carefully review your amendment, Senator, when you bring it. But I need to respond, and again, to make it very clear. I'm not opposed at all to competition in the marketplace. In fact, my amendment says that if we restrict competition in the marketplace, we should not implement the bill, the provisions that are restricting it. And when we hear the discussion about the fact that Medicare Advantage is paying 14% more on average than fee-for-service, let's remember, fee-for-service on Medicare does not fully compensate the fees for the true services that are provided. We all have discussed the fact that it's below the true cost of the production or of the value of the medicine that is being provided. And that 14% is not just going to providers. Under the Medicare Advantage system, 75% of that excess is returned in additional benefits to Medicare Advantage beneficiaries, which is why they like the program so much. It provides them that extra buffer, that 75% of the differential, in additional benefits. And it's those additional benefits that are making Medicare Advantage such a popular program in our country, and which we should try to salvage rather than to try to eliminate.
Which is why I want a grandfather.
I understand.
Mr. Chairman.
I'd like to first ask the senator, is there a cost to his bill?
Yes, and it's interesting, the bill, as I understand it, has been scored, my amendment, and it's been scored at something like $130 billion price tag, which tells you that CBO thinks that virtually the entire Medicare Advantage segment of the chairman's mark is going to be knocked out by this amendment, which means they think that most of the Medicare Advantage competition is going to be restricted. So although there is a high price tag, Mr. Chairman, I actually think that the CBO scoring tells you something about how CBO thinks the chairman's mark is going to impact competition in this arena.
So the CBO score is 130 billion?
Is that 133?
133 billion, and how do you propose to?
And my proposal is to offset that by corresponding reductions in unspent and unallocated spending from the stimulus package, the American Recovery and Reinvestment Act of 2009. All those signs we see put up on the highways, we could stop spending money on the signs, and we could start putting money in here.
That is, with some reluctance and concern and almost sadness, I must inform the senator that the amendment is not germane. This committee does not have jurisdiction over appropriations, and because it's not germane, I will have to rule it out of order.
Mr. Chairman, you mean because is there no way for this committee to reach through its jurisdiction the unspent dollars in the ARRA?
Correct. This is not the Appropriations Committee. This is the Finance Committee. We don't have jurisdiction over appropriations.
That's the Appropriations.
So it's not germane. Therefore, it's out of order.
Well, I would like to challenge that ruling and ask for a vote on it.
Okay.
Mr. Chairman.
Senator Schumer.
Two Chucks. I I'll be brief. I know we're trying to move this along. I just want to make a point here on the substance of the amendment. It's not related to the chairman's point of order, which I will support. And that is this. You know, there are some of us on this side who see Medicare Advantage working in good ways. I have nonprofits who do Medicare Advantage in parts of my state that do a very good service for seniors, and I'm working with Senator Nelson to try and keep those people viable. We also know, though, that in some areas, the amount of money given to the companies, given the amount of services that are returned, is excessive. It's just too lucrative almost when we're short of health care dollars, and we see a lot of that money not go to the individual. And what we're trying to do is thread the needle and garner back some of those excessive profits without hurting the individual on Medicare Advantage, who actually gets a good plan and a good service. And competition it's sort of strange here. We have our colleagues on that side of the aisle saying let's not have private sector competition, and we're saying let's have it. And it's a little bit ironic because if you believe in the free market, which we all do, you believe in competition. You don't believe in monopoly. You don't believe in oligopoly. You don't believe in 94% of the markets being highly concentrated, which is what the insurance markets are, according to the Justice Department. And so I just want to say to my colleague, to say that competition creates less competition, which is in a certain sense what the amendment says. It says by us having competitive bidding, which is a competitive process, there'll be less competition. I don't quite get it. I would hope that we could work together. This seems to me to be not an ideological issue. My guess is my colleagues on the other side would like to save money if it's not going to hurt services. We would like to preserve the services to senior citizens. And this one isn't a public versus private, because it is private already, and at least some of us support it in that form when it does a good job. So that's my point here, and the point of order I will support. But it would be good if we could come to some agreement here that gets rid of the excessive profits but preserves the program for seniors who need it.
Mr. Chairman, could I just
certainly you deserve a response.
Defend my name in one,
that's right.
in one sense?
You deserve a response. Go ahead.
Let me just say once again, read my amendment. It does not say that competition is not going to work because of one thing or another. It simply says, and by the way, my understanding is MedPAC has even said they aren't quite sure how the provisions on Medicare Advantage are actually going to affect markets. All my amendment says is if the impact of this language is to decrease choice and to decrease competition, then we should not implement them. And I believe since there is a serious question about whether the provisions we have proposed before us will do that or not, we simply ought to put a fail-safe in that says this. And so I just wanted to make it clear. Several have indicated now that they interpret this amendment as being against competitive bidding. I'm a huge advocate for competitive bidding, and in fact, the amendment says we want to increase, protect, and assure that we don't decrease the available choice and participants in a competitive market.
I'd like to remind my colleagues, this is an interesting discussion, but it's moot. This amendment is not germane enough to rule out of order. And I just urge, strike that. Amendment's out of order. Does the Senator wish to vote?
Yes, I do.
Okay. Clerk, call the roll on the ruling to motion to overrule the chair.
Mr. Rockefeller.
That's a no.
Mr. Rockefeller, no. Mr. Conrad.
No.
Mr. Conrad, no. Mrs. Lincoln. No. Mrs. Lincoln, no. Mr. Schumer.
No.
Mr. Schumer, no. Ms. Stabenow.
No.
Ms. Stabenow, no. Mr. Nelson.
No.
Mr. Nelson, no. Mr. Menendez.
No.
Mr. Menendez, no. Mr. Grassley.
Aye.
Mr. Grassley, aye. Mr. Hatch. Aye. Mr. Hatch, aye. Ms. Snow. Ms. Snow, no. Mr. Kyle. Mr. Kyle, aye. Mr. Bunning. Mr. Bunning, aye. Mr. Crapo. Mr. Crapo, aye. Mr. Roberts. Mr. Roberts, aye. Mr. Enzi.
Aye.
Mr. Enzi, aye. Mr. Cornyn. Aye. Mr. Cornyn, aye. Mr. Chairman.
No.
Chairman votes no. Mr. Chairman, the final tally is 8 ayes and 9 nays.
2/3 of those present not having voted in the affirmative, it won't change, absolutely. It will not change. Senator
Mr. Henson? Aye.
2/3 senators not having voted in the affirmative to overrule the chair, the ruling stand.